is Liam Young. I'm a lecturer in anatomy at UCLan, which is the University of Central Lancashire, based in Preston. I teach anatomy to a whole host of courses, MBBS, which is the medical course, dental students, hygiene therapy for dental students. We have MPAS students who are physician associates, and we have some science students as well, just finished up this year. So anatomy to a whole host of different courses and students. As the lockdown started, we had a couple of teaching sessions left to give, and primarily revision sessions. And just for a bit of background, how we would normally do those revision sessions would be like a spotter test. So stations out with anatomical models, and they have to identify structures, and then we talk about the anatomy as part of the revision. So we had a few lectures to deliver, which were done through like PowerPoint and through Microsoft Teams, and sort of deliver the material like that. The revision sessions were a bit more challenging. We had to sort of create an online spot test through PowerPoints by adding images to the slides and pins in the images and talking about the anatomical structures in the images. And that was kind of all we had before they finished up their exams. So we didn't have a whole host of teaching to get through. I think one of the main problems we're facing is that lack of, face-to-face interaction and community amongst the students as well. So it's viscerally, we know it's different to teach through a computer screen, even if you can see someone else's face as being physically stood in front of someone. It's a different experience, I think. So trying to bridge that gap is our main challenge, while allowing the students to have contact with each other and work together and really focus on that sort of team work aspect of the course. It helps by providing sort of a three-dimensional aspect to the lectures. So, anatomy can be, read off a textbook or 2D slide, and really what it needs to come to life is something three-dimensional, or something to explain it more, or to help you understand layers and how things are situated around each other. And I think that's where Anatomage really, really helps. I think, first of all, the Anatomage on the cloud was a great idea, particularly for ourselves, coming from starting to really use the Anatomage tables more in person to then not having them, that it fills that void and allowing us to use something similar. And what I do like about it is it's very, very similar, if not identical, to the physical table. So it's not been a huge learning curve for myself to get used to using it. Other members of faculty who might use it less still have that little bit of a learning curve to get used to it. But for positives, I think it's something that we needed because we couldn't use the physical tables, and having the digital version also means it's much easier to transfer screenshots or videos or things between my work laptop and the Anatomage on the cloud. Again, I know I've said, but I like how similar it is to the table. You have all the cadavers there available. You have the histology still. You have the case studies still. So I like that all the material is still available there. I think that's a very good thing. So some lectures will be pre-recorded and put online, in which case I will use the Anatomage as part of that on the cloud. So it'll be part of a screen recording. I'll also be using it in live sessions and sharing a screen with a small group of students. So the way we run our anatomy practical sessions, which we're hoping to try and continue in to the online teaching, is a lab with a series of workshops where they have, you know, set tasks at 3 workshops per lab. So one of those workshops would consist of the Anatomage on the cloud and a tutor there, you know, walking them through some structures, asking questions, maybe working through a clinical case, using the anatomy and the Anatomage to discuss the anatomy underlying that case or that question. And again, although it'll be used for pre-recordings, I think what the Anatomage on the cloud is really particularly useful is showing that 3-dimensional visualization interactively in person or in real time. You know, you have the students there with you, they can ask questions. We use Microsoft Teams for a lot of our teaching, so they can request control if they want to ask a question. You can do it with one student at a time. So I think where you get the most out of it is when you have students there in real time with you to ask questions, and you can explain things, and you have that freedom of structures and that 3-dimensional model to go into detail that you might not normally have in a 2-dimensional textbook or lecture, or, you know, a pre-recording of the Anatomage table. At least with the live sessions, you can sort of adapt and mold your teaching session around that. There are a couple which I think are sort of complex and, you know, students struggle to understand. And I do a lot of anatomy teaching to the dental students in head and neck anatomy. And one of the areas, the complicated areas, is this area in here, sort of round about the zygomatic arch and the mandible, where we have a whole host of muscles, nerves, vessels, all between this infratemporal fossa and pterygopalatine area behind there. So this sort of, it's one of these things that is difficult to understand because there's layering involved. You know, you have muscle, and then you have the mandible, and then you have a space which we talk about for nerves running through, and then you have another space behind that which is something different, which has something different running through it, and that layering is difficult to portray in a 2-dimensional way. So what is useful about the table on the cloud is having the ability to, you know, real time get rid of, move structures about. You know, I'm not going to go through all the functions, we know the functions of the Anatomage table, but being able to identify these areas along with the vessels that we're talking about, and, you know, point out that, you know, this is, when I say infratemporal fossa, you know, I'm talking about this area. However, when I say pterygopalatine, we're going further medial, we're going further inside the back of the infratemporal fossa. These areas where there are more than one layer to it are what I think is the sort of real benefit of the Anatomage table. So that's one example. Head and neck in general, I think it can be a complicated area. So I think that's a good example. The other thing is that when we come to talk about muscles, I like to teach muscles through movement, sort of, you know, rather than getting bogged down into the individual attachments of a muscle. So a big thing of the Anatomage table is being able to draw. So say I'm talking about the TMJ movements, then I like to be able to demonstrate where a muscle would be, and then allow the students to work out, you know, what kind of movement we expect from this muscle and what joint we're going to be moving. And from a flat image or from text on a PowerPoint slide, you don't get that problem solving aspect. Whereas being able to combine that, okay, well, if I put a muscle here, what joint are we going to be moving? And in this case, it's the TMJ. And again, I think that problem solving element is very important, which the Anatomage table, physical or on the cloud, allows us to attack anatomy from that angle. I think that's useful.